women every year. Chance of somebody having breast cancer is about 1 in 8, which means one of you, right? We got what? 7. No, the 8th person's not here, so you guys are all okay.
Yeah.
But you think about that. One of you, statistically, will have cancer at some point in your life. That's a scary thing. It's a leading killer of women aged 35 to 54. Now, why is 35 to 54 important? When are we supposed to start mammograms?
40?
40, okay? But they're changing.
50, right?
It's gonna be 50,
Yeah.
okay? Why? Why are they changing?
False positives?
False positive.
Misdiagnosis?
Well, it is, the mammogram is causing more damage
Right.
than it is helping.
Yeah.
Between 40 and 50. Why? Because breasts are more dense when between 40 and 50. So between 40 and 50, your breast tissue is still dense. There's not enough difference between the breast tissue and the cancer tissue. That's why it's hard to find, especially if you have dense breast tissue. Say that 3 times fast.
Dense breast tissue.
Exactly. It's harder to find things on mammograms, and that's why it's bad, and that's why they're changing those. And 47,000 women under the age of 50 die every year. Okay? That is a ton. Okay, so if we move the screening age to 50, that means 47,000 women die before they've ever even been screened. Okay, that's a scary thought. We spend $12 billion on breast cancer research every year, and then new research shows that mammograms are actually increasing our risk of cancer. Okay? They've done studies, and we're finding more early stage breast cancer, but we're also not changing the mortality rate. So that's the problem. We're finding it too late. It's not doing what it's supposed to do. We're doing more overdiagnosis than we're supposed to. We're doing more biopsies than we're supposed to because we're getting so many false positives with mammograms. Okay. So, a little anatomy lesson, a little history lesson here. What's cancer? Cancer is the uncontrolled proliferation of cells, okay, in the body. The key is, what does cancer need for it to organize and grow and become a tumor? So I got 2 cells sitting there that are cancer cells. What do they need that your normal breast tissue doesn't need?
What do they need that the normal breast tissue doesn't need?
Yep. So normal breast tissue is like a warehouse. It needs just kind of storage, right? It's normally fat tissue for the most part. Cancer cells are very active. They're multiplying, they're getting bigger, they're organizing, okay? What do they need? What do they have to have?
Stress, sugar.
How do they get the sugar?
An alkaline state, is there something with alkaline?
Alkaline helps, but what do they need to grow? Okay, what does everything need to grow to get bigger? Even your kids.
Nutrients.
Huh? Oxygen, yep.
Food.
Food. How do you get food? How do you get food from your mouth to your cells?
Blood.
Blood. Okay? That is the key, and that is the key.
Yeah.
There you go. I know it's going to be tough, but I'm getting out of here. Cancer has to have a blood supply.
Yeah.
And that is the key to thermography. Okay? A cancer cell and a cancer tumor
Oh, wow.
has to have a blood supply. Normal breast tissue is very avascular.
Right.
So if I have an avascular area, and then I have a tumor there, it's going to have a bunch of blood cells going to it.
Right.
Or blood vessels, I should say. Okay? Those blood vessels, they're going to be colder or hotter than
Hotter.
normal breast tissue. It's going to be hotter, right? That is the basis of thermography. Okay, you guys got it already.
It's a hot spot.
Again, you look right here, we have a very small tumor, and then you get basal growth factor, and then you get blood vessels attached to it, and then the next thing you know, you get all kinds of blood vessels attached to it. Okay? That's kind of how the cancer organizes and then grows and grows and grows. And in fact, the more it grows, the further along it is, the hotter that's going to get.
What attracts the blood vessels to that area? Is that a known thing or no?
It is, it's our innate intelligence, it's our body. Okay, our body says, hey, we have something that's growing there. The body doesn't know that it is cancer.
Oh.
It knows that we got cells in that area. You know, it's kind of like the body knows that a fat cell is going to be a fat cell and it's going to be storage. So you know what, I have some extra Glucose, we're just gonna shove that in this fat cell for today and we're just gonna leave it sit there till I need it later.
Right.
If it has cells that are just down there and they're just using energy, say it's your stomach, okay, it knows you just ate, so God, I gotta get more energy to those blood cells, the stomach cells to digest the food or whatever it is. So the body thinks that the tumor is actually growing, it's something that is getting bigger, so we continue to feed that. And we have to give blood supply to it to feed it.
It makes sense. It just
Yep.
picks up on
Exactly.
So my question with tumors is, like a blister on the outside of the skin, isn't a tumor something where it's your body's in a protective way trying to gather all of the cancer cells and like kind of isolate it
They will.
from the rest of the body?
Yep.
Okay.
So ductal carcinoma in situ is one of those cases where it will actually encapsulate that cancer. Okay, DCIS is one of the least invasive cancers because it gets encapsulated and the body kind of walls it off.
Right.
Okay, that's one of the body's defense mechanisms against it. Some of them it's not able to do that.
Right.
Okay, so when it's not able to, that's when we run into a problem. That's when you get more aggressive and we keep feeding and we keep feeding. Okay. So here's again, this is just for demonstration, but cancer cells double about every 90 days. So if you start in year 1, you got 1 cell, you go to 16 to 256, okay? In order for it to be detected by a mammogram, you gotta be down here in the 4 billion cell area, okay? We can detect things with thermography all the way up here in year 4, year 3, where it's like 1,000 cells. Okay? If I got a 1,000 cell tumor, you think that maybe some nutritional advice might be good for that person?
Yeah.
You think maybe a chiropractic adjustment or many of the things that we do would be good for them? Okay, one of my favorite patients, lady came in and she was about 4'11" wide and 4'11" tall. She weighed 400 pounds. Came in, got a thermogram, came back, and I'm like, you got something going on there. She went and got a mammogram done. Mammogram showed nothing. Okay.
Wow.
So she says, what do I do, doc? I said, well, you have some choices. You're 400 pounds, you smoke 4 packs a day or 2 packs a day, whatever it is, you drink a 6-pack and 12-pack of beer a day. I mean, she just had the worst lifestyle you could have. And I said, it's time to make some changes. So she quit drinking cold turkey. She quit smoking cold turkey. She started eating well. Within about a year and a half, she lost half her body. She lost over 200 pounds. Wow. Her scans came back great. Didn't have any issues whatsoever with the scans. That kind of disappeared. And I said, you know what? Even if that scan was wrong, okay, worst case scenario is my scan was wrong. The worst case scenario is you got healthy. Okay, that's a great thing. Okay, we're finding out and we're doing a scan that has no side effects, no harmful stuff, no anything. So that is the other great possibility thing with it too. But again, if we find something here, if we gotta wait until we're down here, now it's time to do biopsies, radiation, chemotherapy. Actually, a girl that I used to date just sent me a text the other day. She's 50 years old and she's got stage 2 breast cancer. Just didn't know it chemo before she contacted me, of course. But and she's coming to get a thermogram in next week sometime, or 2 weeks, whatever. And what's sad is, when I first got into thermography, I've always been friends with hers on Facebook. I messaged her back 10 years ago. And I really, really wish that she would have came then, but she didn't. She lived out the other side of Cedar Rapids, and it was just too much of a hassle, etc. So, all right.
But you planted that seed.
We did.
Yep.
So she's here now, and hopefully we'll help her get through this and
Absolutely.
not get more. So, tumor found by getting a regular mammogram is just smaller than a dime. First mammogram is about the size of a dime. Tumor found by regular breast self-examination is about the size of a quarter, and then found by accident is the size of a 50-cent piece. Okay? How big do you think a tumor is that can be found by thermography?
Like a pencil point?
Okay? Smaller.
Really?
Really? All right? It's that big. Can you see it?
No.
than I do because it's not up there.
Okay.
Okay? It's so small that it can't be seen with the human eye.
Wow.
Okay? Now, I want to make this where it is, because that's the first question. Okay, it's so small you can't see with the human eye. How can you see with thermography? Okay? I try to make this as best as I can. I'm going to say that a city is a tumor. Okay, farmland is
Some
natural
cities, I
breast.
would agree.
Exactly. Most cities are, but so farmland is your natural breast tissue, and a city is a tumor. Does anybody see any cities in this picture?
Not really.
No? Looks just like all farmland, right? But if I had a special camera that could highlight interstates, anybody give me an idea of where a tumor might be?
At the intersection of the interstates.
Okay, exactly. Do blood vessels grow in circles? No, blood vessels grow like trees. Okay? So if I see a blood vessel that's a circle, I know that's not right. And I know there's probably something going on there. Okay, because those circles will encapsulate that tumor and just continue to feed that tumor. Okay? Now, if you don't know, this is the Quad Cities, and we're right about here. But it's amazing how the same exact picture with something highlighted. So if I have a camera that can highlight blood vessels,
Right.
I'm not looking for the tumor. I'm not looking at the tumor at all. I'm looking at how the body has changed to allow it to grow.
Right.
Okay? Make sense?
Yes.
Any questions for me so far? No? All right, you guys are doing good. Conventional detection, anatomical approach. We're looking for lumps and bumps. Ultrasounds, MRI, X-rays, mammograms, they're all the same thing. They're all looking for lumps and bumps. They all have different ways of finding them, but they're all looking for lumps and bumps. You either have a lump or bump or you don't. Okay? In my opinion, mammogram is the worst because it's the most dangerous of it because it has the most radiation. Okay, ultrasound is good for finding, if I can give it a specific spot, an ultrasound is a good test. So that's actually our first recommendation. If I see something that's going on a thermography, I'll recommend for an ultrasound of the right breast, 2 centimeters from the nipple at 2 o'clock or whatever. So I'll give a specific spot that I want them to look. Ultrasound is not a very good test for the entire breast and both breasts. Okay. MRI is a great test for everything, but it's $2,000, and we just can't do that as a general screening principle because we would never. First of all, you couldn't get people through the MRI machines, and second of all, it would just be way too expensive. To do
Isn't
that.
there a thing where they can detect? It's like an MRI, but it's for breast, and they detect the cancer cells, the different motion. It's like it's an something, a magnetic resolution.
If it's an MRI, it's possible. And I know you can do MRIs on breast because that's part of it.
Like a machine, right?
Yeah, it's a very expensive test. It's very expensive to read because you're taking like all these kinds of different images of, you're taking slices of the breast tissue that you're taking images of, and it's probably the best test. It's just too expensive. Okay.
Yeah, I know they have to inject you too with the
Yeah,
contrast.
and a lot of times if you have a dye, then you obviously there's an injection there, which is kind of defeats the purpose of not having radiation.
Right.
So, mammogram took 25 years to approve as a standard. It's looking for anatomical changes. It's looking for the lumps and bumps. It's looking for those physical changes. It emits ionizing radiation, which is 100 times the radiation from a chest X-ray. Okay? And these numbers are from the National Institute of Health website. It's not just me pulling stuff out of the air.
There's also a 3D mammogram
Yep.
now. Is that more
It's the
than
same.
that? It's the same. It's just it just translates the information
Yep.
differently. Okay.
Yep. Okay, this to me, personally, is the worst part. 80% of biopsies are negative. Okay? So, do you have one that was negative?
Yeah, I don't want to like overpower anything that's going on, but I think it was like 3 years ago. I was just traumatized. That was right before I figured out all about the thermography and
Okay.
everything, and First one breast, they saw calcification, scared me something is not normal.
Right.
Come back in, go into the special mobile, they did a pretty invasive biopsy, and they put a marker inside of me, and then they do more x-rays, it's just more and more and more, and then the next year it was the other breast. And so same thing, and so now I have a marker in each breast, and
Right.
of course there was the calcifications, and scared me pretty bad, and everything then was okay, they said.
Right.
So I'm full of, the false.
Full of false positives, yeah.
Yeah,
But,
me too.
so
And
now-
do the markers affect the thermography though? Will they affect it? No?
No, the markers are gonna be the same temperature as the surrounding tissue,
Okay.
okay? Just like if I have this piece of paper, it's gonna be about 74 degrees because it's just gonna adapt to whatever is, the
Okay.
air is, okay?
Yeah.
By the time I'm, for a lack of better words, I'm in the process of going down this rabbit hole that everybody talks about. So the second time, I didn't want them putting that marker in because I'm like, I don't need another piece. I'm full of metal.
Right.
Mouth, now breasts,
Mhm.
my feet, and I didn't want. And they talked to me and said, "Oh, they called it their, not the, it's the little charms, the expensive charms. Oh, I can't think of it now."
Like sterling silver, or are they?
Oh, it's a special name for a charm. But
titanium?
I'll think of it some other time, but they just made it sound so elegant.
So
like
easy,
it was
oh, yeah.
a charm. So yeah, they went in. But anyway, so the false positives, I know all
Yep.
about those things.
So you get 80% are false positives, okay? 20% are false negatives, okay? Which means that it says you're fine, but you're not,
Right.
okay? So 20% of the time they say, yeah, you're good to go, but you're not. And 80% of the time is you got something going on and you don't. So that's really a bad combination. Okay, so they're really good at finding lumps and bumps, and I'll never, people say mammograms are the best tool. They're really, really good at doing what they're designed to do, which is finding lumps and bumps. They are really, really bad at determining whether the lump and bump is good or bad.
Right.
Okay? I've heard they're
They're even
painful.
worse at preventative.
Huh?
They're even worse at preventative. Because by the
Exactly.
time you have those things, you're in that higher risk factor
Right, right.
for aggressive. Yeah.
I just wanted to add
Yeah.
one more little thing. Somebody said something earlier and I didn't catch it, but I did have the technician, I wanted to speak with her a little more in depth about, well, what calcifications and why do I have to have this follow-up and blah, blah, blah. And she said, well, we have to do so many a year of these. And then she wouldn't really go any further. But she
Yeah.
said that to me, we have to do so many of these. And I thought, that doesn't sound very nice to me. We have a quote.
You know,
Speeding tickets for breasts.
Yeah.
Got it.
I have another friend.
Wow.
Just like about it though, right?
63%.
I did have another friend that her mom had breast cancer and had breast cancer in her family. And she was a large-breasted, dense-breasted woman. No one would be. But, so she started getting mammograms when she was 30. Every time she went to get them, they'd have to come back for a second one. And she was getting them twice a year. So she was getting 4 mammograms a year from the time she was 30. And I told her, I said, if you don't have cancer by the time you're 50, just from the mammograms alone,
Yeah.
from the radiation, you're in trouble. So anyhow, I've heard they're painful. I haven't had them, but some people say they're painful. Some people don't have a problem with it. Right now, mammogram guidelines are being challenged. Okay, we're going to 50. Okay, it's on its way there. It's been on its way there for a long time. Actually,
But it has to do with
It's politics.
dense breast tissue too,
Yeah.
right? Which is, does everyone know what that is? I was just reading about it, the dense breast tissue. The normal breast and the average breast is fatty, and a dense breast tissue has more tissue, just like it says, but it's more glandular. It's just a different structure of your body.
well, and it's even just you have to think about this. Okay, if I'm taking an X-ray, I take an X-ray of my arm. Okay, on a scale of 1 to 10, the bone is say a 9 as far as density goes, and my muscles are maybe it used to be 7 right now. They're probably 3, but we'll go with 3. So if I take an X-ray and shoot it through there, it's really easy to find that bone because there's a difference of 7 or 8 spots on that scale. Okay, If I have breast tissue that is, say, a 7 on a scale of 1 to 10 as far as density, and the tumor is 7.5 on that same scale, it's very difficult to find it because we're looking for density changes. If I have breast tissue that is no longer dense, and it's, say, a scale, it's a 3, the tumor is still a 7, now it's easier to find it because you have to have that differentiation between the two cells.
Right, I heard that on the screening, like the cysts come up black, but tumors come up the
White.
same white, same color as dense breast tissue.
Yep.
They're like together.
And I'll show you a picture of that here shortly.
Yeah,
So-
it's interesting.
So one of the funnies I found here is which button do I push? Do I detect cancer? Or do I cause cancer? Yeah, we usually just push them both. And then this is the new U.S. Task Force guidelines. The guidelines have already come out. Okay, you know how our political system works. To get through the AMA, to get through all that, it's going to take some time. But the guidelines say, and actually, I talked to a guy from Palm Springs who actually worked on the guidelines. I really am. He's going to actually buy a camera from me, and I'm going to go down there, and I'm really looking forward to just chewing his ear and seeing how that went, the whole process. But he was actually on the committee that made those guideline changes. So, all right. So let's talk a little bit about thermography. We're looking at physiological changes, not anatomical changes. We are not looking for the lumps and bumps. It's been FDA approved since 1982. It can detect things up to 10 years before a mammogram. Okay? So, very well, I could have found something on my friend 10 years ago and made some healthy changes for her, and she could have been a whole lot healthier person right now. Okay? That's why you said, I don't know if I want to know. Well, I want to know if I'm in stage 0 or something like that. I can make some easy changes. It's much easier to put down that can of beer or whatever it is that we do this bad, because everybody has some kind of advice, as opposed to chemo and radiation and biopsies and mastectomies and lumpectomies and all that kind of fun stuff. There's absolutely 0 radiation. It's as safe as getting your picture taken. Okay? Put my phone out and take my picture. It's the exact same thing. All we're doing is we're reading the infrared images that you're putting off as opposed to the visible light image or wavelength you're putting off. Okay?
Can it be done in the whole body or just the breast?
The whole body.
Whole body. I had the whole body one.
You did?
Yep.
Okay.
Yep.
Really? Wow.
It can be done in the whole body. We typically promote and advertise for breast because that is the biggest one that people are concerned about. But yes, we do the whole body. And I'll show you some pictures of full body stuff as well. Okay? It's absolutely.
Don't show my pictures.
I won't show you pictures. Well, those are the absolute end of it.
Those are the things that are there.
Exactly. So this picture right here is actually Joni.
I thought you loved the way I look. Check me out, everyone.
No, that is not Joni. I'm not sure who that is.
Look at my beautiful thermography boobs.
It is 100% safe at any age. Okay, so we do scans on kids. Okay, we don't do a lot of scans on kids, but if I have kids that have some issues and moms want to get them done, we run a special with if mom comes in, the kid gets it for a very low price. I don't even know what it is. It's like $50.
That's so great of you to
like that.
offer. Thank you for doing that.
It is 97% accurate when it comes to breast cancer. I'll show you the study here in a second on kind of how that works, okay? Or the study did anyhow. So, this is early thermography. Okay? Anybody remember the Polaroid camera?
Yes.
Yeah.
That's what this is a Polaroid. And we had a screen that they would press against the breast tissue, and they'd take a picture of the screen. And then the Polaroid would zip out and you'd have your thermography done. Well, if I take my hand and I put my hand like this, and I pull it away, you can see my handprint after I take a picture of it.
Right.
So pressing something against the breast is going to change the entire thermography. Second of all, what's the difference? Is a Polaroid camera as good as a new digital camera?
No.
Not quite the same thing, okay? So that's why back in the 70s, I actually had a patient that used to do thermography, used to be covered by Medicare, used to be like the thing back in the 70s, and she was a thermography tech back then.
Wow.
And we got some bad studies back then because that was the technology. Today we have a digital camera that is much better. So we've made leaps and bounds since then. So, all right. This is how bad it was just 5 years ago. Okay? This is what our images look like now. Okay, you can see how clear the images are, you can see the different areas, and then we also use grayscale where you can see the vascular patterns as well.
Wow.
Okay?
That is
So,
amazing.
It is pretty clear. And actually, this is the 7320. They actually have a newer camera that is, I don't have that yet, but it is the 9000. So there's 2 more series that are even, this is a 320 resolution, and they have a 640 resolution camera as well. So that'll probably be my next purchase one of these days. So this is just a statement from the FDA. I'm not going to read it, but you can take a picture of it if you want to. It's a system used for the diagnostic screening tool for detection of breast cancer. It is an adjunctive screening right now, so the FDA says we need to screen with mammography. Okay. I think as you know, they're probably going to eventually change those guidelines so that this is the best screening for anybody under 50. Okay, again, that's my thought. I don't know where they're going to go, and you have to do what the FDA says. That's just part of life. So, but that is kind of how it's used right now. So this is my test. This is my study that where I got to 97%. So they had a thing. Had 94 different people that came back with positive mammograms. Okay, so we had 94 lumps. We're trying to find out are those lumps good or bad. Okay? So we decided let's do thermography on them before we do biopsy, because biopsy is the only way to determine if it's cancer or not. Okay, we all know that. I can see a thermography and I can say, you know what, 99.9% chance that's cancer, but the only way to really know it's cancer is to get the biopsy. So 94 biopsies, let's see, 60 were malignant, 34 were benign, okay, when they did the biopsy. Okay. Digital thermal imaging identified 58 of the 94. So we missed 2 compared to biopsy. Okay, if you think about it that way, X-ray or mammogram missed 34. We missed 2. The good news is the 2 that we missed were ductal carcinoma in situ. DCIS isn't even considered a cancer in Europe because it is encapsulated. It's so slow growing.
Isolated in the body.
And 95% of people with DCIS are going to die from something besides the DCIS. Okay?
What about when they do the biopsy? Isn't that bad as far as opening up that
If
encapsulation?
you have DCIS and you open up the encapsulation, that's not a good thing. Yeah.
But you know it. Do you know it before you do the biopsy?
No.
So that's the only way to know that that's what.
Well, it
Unless you get
is.
thermography, right?
Well, thermography is going to show it as a much slower growing cancer. Okay. With an X-ray or with a mammogram, DCIS is usually bigger, but it's also going to be much less hot because it's slower growing. It doesn't have the blood supply. So you don't know for sure what it is, but you can probably have a pretty good idea, okay, based on the mammography and the thermography and the ultrasounds and that kind of stuff. But, so we got 58 out of 60. That's how we get to 97%, okay, as far as accuracy goes.
Right.
All right, there's been over 800 articles published on breast cancer, and then things on stroke, skin cancer, heart disease, scoliosis, diabetic neuropathy, etc., etc. Any questions for me?
What, it also detects diabetic neuropathy, is that what you're saying in all this as well?
What you'll see coldness in the feet, coldness in the hands from the neuropathy is you're going to get the cold extremities. Excuse me, scoliosis. It's probably not the greatest thing for scoliosis because you can more see that, but you can see how the heat patterns are in people's backs and how their spine is functioning and the rest of their body is functioning as well. Okay. Questions? So, some quick case studies. This is what lobular cancer looks like on thermography. You can see the dark spot there, and the dark spot there. The difference between the right and the left side, okay, so what we're doing is we're taking a measurement of that spot versus this spot. And in this situation, we got a 3.86 degrees Celsius difference. Anything over 2 is abnormal,
Okay.
okay? So that's almost double that. All right. This person came in, had a mammography where there was a cancer here. There's a little circular pattern there. They had already done a mammogram. There was a cancer there. The doctor was recommending a lumpectomy. Okay, came into us and said, "What should I do? Should I do a lumpectomy or a mastectomy?" What advice do you give her here?
Keep your breasts.
Keep your breast. Okay. Well, in this situation, she had ipsilateral, or contralateral, I'm sorry, lymph node involvement. So she had cancer in those as well.
Wow. And they didn't even find that.
They didn't find it because it was too far back and didn't get in the mammogram machine.
Oh.
Okay. So
Right, and her arms are raised. I mean, you may have to raise an arm.
arms are raised, but
Is that not the
Mammography
opposite
to
side of the body? So it was on both sides of her
yeah,
body?
this was the control. This is the opposite side. So this is the left side here. This cancer was on the right side.
Wow.
So this lady actually ended up getting a double mastectomy. Okay, because, and she's, as far as I know, still alive. Last time I checked, she was.
So she was more informed and she found out that the other side of the body was also affected.
Yep. She found it already had, it's metastasized to the lymph nodes, and the lymph nodes were infected, and she decided, you know what, let's.
What symptoms was she presenting?
I wasn't
You
my
didn't
patient.
know about that? Okay.
I didn't know her as a patient. I didn't know
Okay.
that. This is actually a patient of a friend of mine. So
Awesome. Okay, thanks for sharing.
this is DCIS. Okay, you can see where it's kind of a longer area there, and you can see the vascular pattern on that side. Okay.
DCIS is the one that you said is encapsulated?
Yep, if you're gonna get breast cancer, and the guy comes in and says, you got breast cancer, and the next words are DCIS, you can say, thank God, because that's gonna be the best one of all of them to get. Okay? I'm not a breast cancer expert by any means, that's not my thing, I'm a thermography expert, but that's the one thing I do, that I have learned over the years. All right, is it good for people with implants? Absolutely. Because you don't have to worry about flattening the implant in a
Right.
mammogram machine.
Introducing silicone into your body.
Exactly. You don't have to worry about, you know, the cancer and the blood supply is still going to be on the front side of that, in 99% of cases, on the front side of the implant. So you're still going to be able to find it. So again, you can see right here, there it is. Okay.